Hi, my name is Lori. I'm a clinical nurse at the Community Health Clinic. I'm here to discuss MYBPC3. Myosin binding protein C cardiac type is a protein that in humans is encoded by the MYBPC3 gene. This protein is expressed exclusively in the heart muscle cells. In these cells, cardiac MYBPC is associated with a structure called the sarcomere, which is the basic unit of muscle contraction in the heart. When the MYBPC3 gene is mutated, this causes an abnormally short or altered cardiac MYBPC protein that does not work well. When a person inherits one mutated copy of the MYBPC3 gene, he or she will have hypertrophic cardiomyopathy type 4 or be at risk for it. HCM4 is an inherited disease. There are other causes of hypertrophic cardiomyopathy that are not inherited. HCM4 caused by the MYBPC3 gene mutation is autosomal dominant, meaning you only need one copy of the mutated gene to have the disease. Symptoms of HCM4 are different even within the same family. Some people may experience chest pain or shortness of breath with or without activity. Many have fluttering or pounding in their chest, known as palpitations. Some have lightheadedness or dizziness or even fainting with physical activity. Some people have no symptoms. It can also be associated with serious and life-threatening abnormal rhythms of the heart, known as arrhythmias, or even heart failure. People with HCM4 are also at risk for sudden cardiac death, even with no symptoms. It is recommended that if you know that this disorder is in your family, that you and your family be screened for it and that the family have CPR training. Families with a change in the MYBPC3 gene should start being screened at around 10 years of age. If the gene change is found, a cardiac evaluation will be recommended. This will include an echocardiogram, which takes a look at your heart muscle, how thick it is, making sure that it's functioning properly. And we'll also recommend an EKG, which checks the electrical activity of your heart, going along with the arrhythmias. And then you're going to also be recommended to see a cardiologist to go over the results of everything and what your risks are and how often you should be checked. We have partnered with St. Vincent's pediatric cardiologist out of Indianapolis. Dr. Parikh and Dr. Tucker come 3 or 4 times a year. And then we also have Dr. Mark O'Shaughnessy out of Fort Wayne. They bring affordable cardiology visits to the clinic for patients that have no insurance. 30% of all familial or inherited hypertrophic cardiomyopathies are caused by mutations in this gene. In our clinic, we've screened 450 patients with 210 positive cases. That's 47% of our patients have tested positive for this gene mutation. Now, in our clinic, most of our patients are of Amish ancestry. Thank you.